Have you stopped to look at your tongue today? It's the secret mirror of your health. And after 70, it might be sending 5 silent signals that your body is desperately crying for help. Will you ignore them? I see this every day. People over 70 years old come into my clinic with all sorts of aches, pains, and health concerns. But when I look at their tongues, I find clues that point me in the right direction for diagnosis. The tongue is a map of our internal health. It can tell us what's going on inside our bodies without us even realizing it. That's because the tongue has tons of sensitive nerves that respond to changes in our overall health. So if something is off balance inside, it often shows up on the tongue first. So today, let's unveil the hidden messages that our tongues are sending us. By understanding the language of the tongue, we can unlock a world of insights into our overall well-being, especially as we age. These 5 urgent signs on your tongue can be a silent alarm bell indicating potential issues lurking beneath the surface. Let's decode them together. Sign number 1. Unusual color changes. Have you noticed any unexpected shifts in your tongue's hue? A healthy tongue should typically be a vibrant pink color, reflecting good blood flow and robust health. However, when that rosy glow fades, it could be hinting at underlying health problems. For example, a tongue that appears too white might signal a lack of saliva, potentially leading to discomfort or even infections. This can happen when people are not drinking enough water or have certain medications that cause dry mouth. On the other hand, a yellow tinge on the tongue could be a sign of jaundice, which often points to liver issues or gallbladder problems. If you notice your tongue taking on a darker red or purple shade, it might indicate poor circulation or even heart trouble. These color changes aren't just aesthetic quirks. They are nature's way of telling us that some vital functions might be off track. Sign number 2. Changes in texture. Another important sign to look out for is any alterations in the texture of your tongue. You see, a healthy tongue has a pleasantly rough surface, providing a good grip for our taste buds and making it easier to eat and speak. But when it comes to texture, there are some changes that you shouldn't ignore. First, if your tongue feels too smooth, almost like velvet, it could mean that you're lacking essential vitamins and minerals like B12 or iron. These nutrients help produce the rough papillae that give our tongues their natural texture. Second, a fissured tongue, which looks like a map of the continents on a globe, might be a sign of dehydration. The tongue can't get enough moisture, so it starts to crack and peel. Finally, a hairy tongue isn't as scary as it sounds, but it's still worth paying attention to. These are elongated taste buds reacting to a buildup of bacteria or a yeast infection. While harmless, it's best to consult your healthcare provider to rule out any underlying issues. Sign number 3. Persistent pain or burning sensation. Have you ever experienced a nagging pain or a strange burning feeling on your tongue? Don't just dismiss it as a minor annoyance. Your tongue is a window into your body's internal temperature. If it's too hot, like 99 degrees or higher, your tongue can become inflamed, swollen, and feel uncomfortably hot. Similarly, if your body's temperature drops below 95 degrees, your tongue might take on a pale gray hue and feel cold. These sensations aren't just annoying. They are your body's way of signaling that the internal thermostat is out of whack. Such symptoms could be an indication of an underlying medical condition like hypothyroidism, diabetes, anemia, or even liver disease. Sign number 4. Loss or alteration of taste. Have you ever lost your sense of taste? In many cases, people often overlook this symptom, assuming it's just a quirk of aging. However, it could also be a sign of a vitamin B12 deficiency, which is common in older adults. This deficiency not only affects taste, but can also lead to fatigue, dizziness, and mood swings. Interestingly, age-related taste changes can also be influenced by social factors. Many seniors living alone tend to eat blander diets, leading to altered taste perceptions. Loss of taste can also be linked to gum disease, which can affect the ability to perceive flavors fully. Sign number 5. difficulty moving the tongue, or swelling. Any sudden or significant change in the way your tongue moves within your mouth should not be taken lightly. If you find yourself struggling to move your tongue smoothly or notice any noticeable swelling, it might be a sign that you need to pay closer attention to your overall health. These symptoms could point to muscular or neurological problems, such as those related to stroke, Parkinson's disease, or multiple sclerosis. They could also indicate that you're not getting enough iodine or selenium in your diet, which affects muscle function. As we age, many of us begin to experience changes in our tongues that we might just brush aside as part of growing old. But here's the truth. These changes are not just normal. They are often the first subtle hints that something might be amiss in our bodies. You see, our tongues are like internal barometers, constantly responding to the internal environment of our bodies. So when we spot these changes, it's our body's way of communicating that it needs our attention. But why are these signs so often ignored? Well, for starters, many of these changes are sneaky and silent. They can easily go unnoticed or mistaken for just another quirk of aging. And finally, there's a common misconception that these signs are just a natural part of growing older, which couldn't be further from the truth. And did you know that over 65% of drugs used by seniors cause oral side effects? These medications can alter the color, texture, or even size of your tongue, making it difficult to spot any abnormalities. Some common culprits are antidepressants, antihistamines, and blood pressure medications. Another culprit is dehydration. As we age, our thirst sensation can diminish, leading us to drink less water than we need. This can make our tongues inflamed, swollen, or even cause them to lose their sense of taste. But it doesn't stop there. Our tongues rely on saliva to stay healthy. Saliva helps keep our mouths moist, making it easier to swallow and digest our food. It also protects our teeth and gums from harmful bacteria. When we're dehydrated, saliva production decreases, making us more vulnerable to cavities and gum disease. But the tongue's story doesn't end there. Did you know that the health of your tongue is closely tied to the levels of certain vitamins and minerals in your body? Believe it or not, our tongues are like little flags waving in the wind, trying to catch our attention and tell us that they need some extra love and care. So let's learn to read these signals and act accordingly. But that's not all. There are also some oral diseases that can show up on your tongue. One of them is candidiasis, which causes white patches on the tongue that might feel painful. This condition often happens when there's an overgrowth of a fungus in the mouth, and it tends to affect people with weakened immune systems or those who are on long-term medication. Another condition that can manifest on the tongue is glossitis, causing inflammation and redness. This can be triggered by vitamin B3 deficiency or autoimmune disorders. Here's where it gets really important. If you spot any of these signs on your tongue, it's time to call your doctor or dentist for a quick chat. Remember, these signs are not just age-related quirks. They might be your body's way of silently raising an alarm. But why should you care about the health of your tongue? Well, here's the thing. The tongue is not just a random part of our body. It's intricately connected to some of our most vital functions. Did you know that your tongue plays a starring role in digestion? When you eat, your tongue takes charge, mixing your food with saliva and grinding it into a soft mass, making it easier to swallow and send it on its journey through your digestive system. Without a healthy tongue, that journey could get pretty bumpy. And let's not forget about speech. Your tongue is like the superstar of your mouth, dancing around to form words and help you articulate your thoughts. But wait, there's more. Your tongue is also a key player in maintaining your body's balance. Yep, you heard that right. When your tongue works its magic, it sends signals to the parts of your brain that keep your body upright and steady. It's like your tongue has its own personal spies keeping an eye on your balance and making sure you stay grounded. Imagine a life where you could not enjoy your favorite foods or where articulating your thoughts was a struggle. It's a sobering thought. That's why it's so important to pay attention to the signs our tongues are giving us. Here's the truth. Ignoring the early signs of trouble can lead to unnecessary suffering down the road. You see, when we spot these signs and address them promptly, we can often nip potential problems in the bud. But if we ignore them, these small issues can snowball into bigger, more complex problems that are much harder to tackle. It's not uncommon for people to live with undiagnosed vitamin B12 deficiency for years. Over time, this can lead to irreversible nerve damage. Similarly, undiagnosed diabetes can cause a host of complications, including vision problems, kidney disease, and cardiovascular issues. As we age, it's natural to assume that some discomfort or changes are just part of the journey. But that doesn't mean we have to accept them without a fight. With a bit of awareness, proactive care, and a willingness to listen to our bodies, we can keep our tongues and our bodies thriving. Did you know that recent research suggests that the tongue might hold even more secrets to our overall health? Scientists have found correlations between the health of the tongue and conditions like hypertension, heart disease, and even cancer. Studies have shown that people with hypertension often have enlarged or swollen tongues, while those with heart disease may exhibit bluish tints on their tongues due to poor circulation. Researchers are even exploring the potential use of artificial intelligence to analyze tongue images, opening up exciting new possibilities for early disease detection. The fact is, our tongues are like personal health assistants, silently working behind the scenes to give us a heads up when things aren't quite right. It's time we return the favor by paying attention to these silent heroes. Now, I want you to pause for a moment and reflect on what you've learned today.